Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
I wanted to have a great opening here. Okay,
That
today,
was
Brad.
nice, Bob.
Today, Brad, we're going to talk about 5 steps to repair a broken collarbone.
Right.
And the question is, will Aaron Rodgers play again by December? Play
Right.
football.
And for the people who aren't football fans, he's a professional quarterback for the Green Bay Packers, broke his collarbone. In that arena, everyone's asking this big question. So after this...
Is that a professional team, the Packers?
Oh, I'll give you more than you deserve.
It's a solemn day in Wisconsin, by the way. After the day after that,
We don't
or 2
care
days
about
after,
all that, Bob, you
our
know.
flags are flying at half-mast. But we're going to show you, if you break a collarbone, my son broke his, by the way.
Right.
So I've kind of have first-hand knowledge of this.
Right.
And what we went through.
I broke mine and dislocated both of them.
Well, I guess you have better first-hand knowledge than we do. So.
And worked with patients as well.
All right, well, let's do this first, Brad.
Right.
If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, even if you break bones, and we upload every day. And also, if you get a chance, go over to the Facebook and like us, because Brad and I like to be liked.
There you go. Okay, broken collarbone, it's kind of like a broken rib. You know, if you break it, chances are there isn't too much you're going to do. Now, in Aaron Rodgers' case, we're talking about surgery. The chances of anybody who's not a professional athlete of having surgery for their collarbone is next to none. Unless...
Except my son had it.
Okay. But he didn't have to, did he?
No, he did.
What was his issue?
Well, the issue was the bone, these actually work good for this. The bone broke, and it was up like this,
Yeah.
and it was actually puncturing through the skin, and I almost was ready to go through the skin.
Okay, right.
Up through the muscle.
And that was my exception that I didn't get to yet. It's either that if it goes through the skin, or it could go down into the subclavian artery and vein and nerve group.
That's a real danger. Then.
Right. So yeah, in that case, you're going to have surgery. But if it's just a crack or a break, and even if it's a dislocation of the AC joint, we better talk about this.
Yeah, we better talk about this stuff. We're talking about stuff and people are going, what are you talking about?
Right, precisely.
So we got the collarbones right here. They're kind of S-shaped, aren't they?
Yeah, if you look down from the top.
And which one did you break, by the way, Brad?
Well, I broke the right one, dislocated the left AC.
So, do you mind? Is it deformed?
No, not really.
Because I've had people that I could tell they broke it. I mean, there's a lump there.
Right.
But it even, it healed a little bit like this.
No, mine didn't dislocate and separate.
Oh, it did.
It was a fracture, but it wasn't complete.
Then you probably don't have any deformity at all then.
No, that's on the long story. I'm not going to get into that, Bob.
Yeah.
No, it worked out good that way. Oh, come on, Gumby. Anyways, so you've got the collarbone here, and if that gets fractured, that's one thing, but it's always important to remember you got the AC, the acromioclavicular joint right here.
Yeah, it attaches here, and it attaches here to the sternum, the manubrium, or what is it?
No, it's the clavicular sternum.
I know, but this right here is the manubrium, isn't it?
Now you're getting into the details. Yeah. But those joints right there, if it dislocates, I've had mine here, I had both of them, and it's painful. And it changes. I mean, right there, you can't move your shoulder like this because of this joint here is not working properly.
The dislocation is probably worse than a break to some extent. Wouldn't you say?
Yeah, I would say it's more painful because
you stretch ligaments and such. And the other thing is what people need to realize about the clavicle, the collarbone, it turns, it rotates. When I lift my arm like this, this turns slightly. I remember a diagram where they talked about having a pin in here. And they could actually see the pin move when the arm moved.
It's not dramatic. It's not.
No, it's not. It's very little. It's very little movement.
It's subtle, but it's important. And if the joints are irritated, they're going to let you know it with that motion.
By the way, the point I want to make: Aaron Rodgers last time broke this side, his left side, and it was 7 to 9 weeks or something like that. And he was back, but he didn't have surgery. This time it's his right side, obviously a little more serious because they are going to do surgery.
Right. Well, maybe the surgery will make it heal faster.
It might.
You know?
Yep, it might.
Who knows? You just never know, and they're not going to tell us.
No, they're not. They're not going to give any word. But a lot of times you're looking at healing time of what, 4 to 8 weeks, For
the bone, and then you need to get the range of motion back and the
Right.
strength, and then get into the game. As far as
So our steps, what's the first step if you break it?
The vast majority of collarbones is going to be this. Probably a sling, just immobilize it, let it rest. And then the other important thing that I think is really important, and this is what I had, can you help me with that, Bob? There we go, is using this strap right here. What I had a figure 8 strap, basically the same thing as this, something that pulls your shoulders back slightly so that you heal with good posture.
Yeah.
You know, if this is forward and it's in that collarbone and everything heals with it forward, so it's difficult to regain that posture, then your shoulder's not going to work as well and you're going to have problems long term.
Yeah, these aren't a bad thing to have even when you don't have a broken collarbone.
Right.
I mean,
and actually, that's what this is for. This really isn't made for a broken collarbone, but I wouldn't hesitate to use it.
Yeah,
you know.
it would work well.
Right, and it's comfortable. I used a figure 8 one where it was Velcro and you had to pull on it.
Sure.
And it was a little uncomfortable. This is more comfortable. So that's usually the first few weeks. You're going to be wearing something to protect it. Let the bone start to heal. And then, Bob, the next thing, range of motion.
Sure.
Right.
Starting to get some movement.
Yeah. Okay. So, and typically active assistive range of motion. You're not just going to take the sling off and start exercising like this because it's going to hurt like crazy, particularly when you get up here. So we're going to do assisted range of motion. And one thing we could use is this
good old knee glide.
Yeah, the good old knee glide, even though it's
for the knee.
Yeah, it's for the knee. It works for the arm as well. And you can put it here, and we're just going to go, I'll do it on this arm so you can see it go out and back. And the nice thing about this is you can put some pressure on it if it tolerates
Right.
it. Initially, you're not going to deal with
whatever
pressure.
pain allows.
Right. Now, a ball.
Would you also do pendulum too or not?
Oh, sure. Right. Yep.
So pendulum is just you lean forward. If I was doing the right side, and it's just start using your body to kind of swing it forward like this.
Yep.
And you could probably go across, even though you might feel that.
Yeah, that's probably going to make it bite, but you can test the waters.
Circles.
Yep.
Circle the other way.
Right.
All that works out good.
Right. You can use a ball for going back and forth. Now, if you happen to have a big ball on a table.
That works out nice, doesn't it?
Because you take your good arm on top of your sore shoulder, and then you can just gently bring it out like this. And you're going to find out that when you get up in here, it's really going to make this uncomfortable when it's not ready.
Yeah.
So this may take a few weeks in itself just to get this range of motion.
It's all guided by pain.
Yeah, exactly.
Pain is going to be your guide, master.
Yep.
Be your master.
We're going to do 10 to 15 reps of these typically.
Sure.
And on this, you can go right to left as well. But again, probably when you go across your body, things are going to get pinched up in there, and it's going to hurt, so don't go so far.
You can do circles.
Yep.
Yep.
It's the beauty of the ball, Bob.
That's right.
The beauty of the ball. Okay, now, when it is
else, did you use a cane too or not?
Oh, you bet. There's so many things you can use. I'm just pulling out a couple of my favorites.
So you can use a broomstick or a cane or anything else like this, but you can grab, I want to make sure it's showing right here. So you can grab this one thumb up, this is thumb up, and you can just work on, this is the side that's affected.
Right,
so I'm just going to go ahead, you can work straight up like this, and then you can also go off to the side and work out that way.
Yep. All these are 10 to 15 reps, 2 to 3 times per day. Use a cold pack if you've overdone it. Very good, Bob. Yeah. Okay. Now, once if you're using the ball and you find out that, you're getting here and it's getting pretty comfortable, and you're going back and forth and things are getting better and you're starting to get up here, you can just use your good arm to help this.
Sure.
Well, then we want to give it a pretty good stretch on the way up because, if you're going to be throwing a ball or get back to higher level activities, this is where this knee glide helps on the wall. I can go up here and really stretch it out like this. Why don't you throw me the little ball, Bob?
Sure. Do you think we're going to get a call from Aaron Rodgers to help him out?
Well, that's what I was kind of wondering. We could see if we can get a video with him.
That's right.
You think that you'd want him on?
Oh, sure.
All right, yeah, we'd have him on. So then you're going to go up like this, and you can really get some end range here. And when it gets to that point and you can push into that, that's a real good sign if you can get up there. But initially, you're just going to go with the good hand. You're going to help out and go as far as you can, 10 to 15 reps, okay? And the whole goal is to get full range of motion, particularly if you're an athlete doing an overhead throw. You really need to have that range of motion. All right.
By the way, I do sincerely feel bad that Aaron got hurt. And you know the old joke about sincerity? The truth, the key to success is sincerity. And once you learn to fake that, you got it made. So,
Are you done, Bob?
yeah. Okay. That kind of fell flat, didn't it?
We're trying to
That kind of fell flat, didn't it? All right, where are we at now? Sport-specific exercise.
Strengthening.
Strengthening.
Strengthening. So once you gain range of motion, you're able to go from here and here. Now, what I used to do with mine is usually when I'd start shooting baskets, okay, because it wasn't a lot of work, you know, but it would still get this whole range of motion going.
And a little bit of strengthening.
And a little bit of strengthening.
And a little bit of active movement.
Right.
Yeah.
So shooting basketball, I think, is good for overhead.
Sure.
Or you could just take a ball and, you know, just bounce it off the wall.
Off the wall,
here,
sure.
Yeah. And hopefully you got a little more air in it than that one.
Sure.
But strengthening, Bob, can you readjust that for me? You're taller.
How do you want it?
Down to the lower one. Yeah, that's it.
This one?
Yep.
Okay.
Okay. And here, I'm going to start. There's a lot of different exercises you can do, but a good one is your old-fashioned rotator cuff strengthening exercises, because you want to get out here.
So you're doing external rotation.
External
just keeping
rotation.
the elbow into the side,
Yep.
right angle here.
Right. And then I'm going to do the other one. I'll show it on this side and pull in, because we do
internal
want
rotation.
these muscles in here to get built up, because
Yeah.
they're going to be very important with that. Again, 10 to 15 reps on these. I like to do 3 sets of 10 is my favorite and goal for these exercises. Now this one is going to hurt a little bit at first, but you're going to pull into scapular retractions like this. And when you get back, watch my shoulders. I'm going to pull
he's
back.
Squeezing his shoulder blades together. This is really important. All the muscles around the shoulder girdle
Right.
all play a core role. I mean, they provide the core muscles for the shoulder.
And I would even go to, we're not going to be able to get to all the exercises for this, particularly if you're higher level, but these are some of them. I would do some reverse flies.
Sure.
Like this, working those muscles in here. And then, in Aaron's case, if he's watching, you know, we're going to start doing some this exercise with starting out low and then more full range of motion with a low resistance, and then you can double it up or get to heavier resistance. And so you're getting more specific to the activity or the sport that you're working on, and just
sometimes they even start on a table, don't they?
Right.
And start working it that way.
Exactly. Yeah.
So.
All right.
We'll get you back, Aaron. We'll get you back.
Well, one way or another, whether you're Aaron Rodgers or you're playing, backyard football with your children, and because that's what happened to me. I was playing volleyball the one time. One was on my testing for my black belt. Next was playing volleyball, and I don't remember what the third one was, but it was something. I fell on my elbow, just exactly like he did.
My son fell right onto his shoulder.
It's either on the shoulder or on the elbow.
He was trying to catch 2 Frisbees at the same time.
Ah.
So, all right.
Kids will be kids.
Yep. Thanks everybody for watching.